Hello, everyone. Good morning, good afternoon, and good evening to everybody that is tuning in. We are coming live to you from New York City, and would like to extend a very warm welcome to all of our viewers in the digital health community to the September HitLab Symposium titled Digital Interventions in Healthcare, where we will be hearing from experts, thought leaders, physicians, and entrepreneurs from all different areas of healthcare, as well as different parts of the world. So wherever you're listening, I hope you're having a good day and you're ready for some learnings in the realms of digital health and the interventions in healthcare. I'm Jerry Antimano. I am the Community Development Manager at HitLab. I manage the internal community development within the staff, as well as the external development with the events that we run and the sponsors and key partners that we have at HitLab. We're excited to welcome all of our speakers and panelists who will be sharing their experiences and insights today, as well as our moderators and interviewers who are going to be guiding the intelligent and thoughtful discussions over the next 3 hours as we hop in rapid succession through the various panels and interviews that we are expecting to be fully interactive and engaging with everybody tuning in today, again, wherever you may be in the world. The chat box and the Q&A boxes are fully open, so please feel free to use them to network with everyone in the crowd today. And also put forward questions to the speakers that are lined up for you. Do keep an eye on that chat box, as our social media guru, Maddie Lazar, will be putting information about the speakers and the moderators participating in today's event to help you get connected to them and learn a little bit more about their organizations as well. And on that note, I want to recognize the rest of the HitLab team behind the scenes that have helped put this event together for you. Kevin Stoll, Jess Jamie, Rachel Fredman, and of course, as mentioned just now, Maddie Lazar, who is going to be keeping you up to date via that chat box throughout the course of the symposium. So, what do we have lined up for you today? So we have no less than 11 rapid sessions where our speakers are going to be talking about digital interventions that are playing a role in healthcare from provider side to the patient side, and how these interventions and solutions are being implemented and adopted from a government level to grassroots, and the challenges and benefits of technology and research, training, data security, remote patient monitoring, and medication adherence. So let's take a quick run through the agenda just before we get started. So after this quick introduction by myself, we're going to be going to the fourth wave series with a panel moderated by Paul Saunier, our senior HitLab fellow. He'll be interviewing Eric Novick, the founder and CEO of Generable, and Sergey Askanov, the Senior Director in Early Development Pharmacometrics Director at Novartis Institutes for Biomedical Research. They'll be discussing challenges and opportunities in drug development and different digital methodologies currently being applied in oncology. After that exciting panel at 11:30, we're going to be going to Prem Srinivasan, who's got a couple of segments today, our Director of Medical Affairs at HitLab, who will be interviewing Steve Garsk, the CIO for Pipeline Health, and they'll be talking about mitigating IT security threats in the healthcare system and what the outlook for healthcare IT is going to look like going into the future. And then after that quarter of an hour, we will then have HitLab Symposium regular, Sheila Collins, who's a Senior Advisor for Startup Programming for AARP Innovation Labs, who will be interviewing Anna Bernaka, the founder and CEO of MindMics, which is a tech startup delivering next generation health and wellness monitoring. So that'll be really exciting to see what they have lined up for you. And after the symposium today, when we wrap up at 2 o'clock, Sheila will also mention that the AARP Innovation Labs has also got their grand pitch happening from 2, I believe, till 6 today. So do tune into that and hop over there right after, as we will have the winner of the HitLab AARP Innovation Lab Social Connections Challenge, Victor Wang from Care.Coach, presenting over there. So that'll be really exciting if you haven't had enough of the symposium today. And then 11:45, we're going to, 12 o'clock, we are going over to the West Coast with Dr. Wen Drombalski, the Chief Conversion Officer of Catalyze, and connecting her all the way across the world to the Philippines with Dr. Francis Fernandez, the Interventional Cardiology Research Fellow over at the Medical City. And they're going to be talking about the way that digital health is being implemented and adopted, and the challenges to digitally transform the health system with an aged infrastructure on that side of the world in Southeast Asia. So that will be really interesting to hear, and really looking forward to that conversation. Bringing it a bit closer to home, coming back closer and landing in Europe, in the UK, we're going to be talking to João Bocas, the CEO of the Digital Salutum. Nathan Sundheimer from Plug and Play is going to be interviewing him and discussing the role of wearable technology and remote patient monitoring. After that lively discussion, at 12:30, we then have Sarah Chochki, our Director of Research at HitLab, interviewing Amir Rayuveni, the CEO of Wesper, formerly known as Tatch, and discussing their graduation, quote unquote, from the HitLab Breakthrough Alliance and the effect that chronic sleep disorders are having on consumers nowadays. So it'd be great to hear from Amir and what he's been doing ever since coming through the HitLab Breakthrough Alliance. At 12:45, Prem Srinivasan is back with a vengeance, taking not only just one panel, but two in a row. So at 12:45, he's going to be talking to Robin Roberts, the Chief Operating Officer and Head of Strategy at the Novartis Biome. And they're going to be talking about the effects of digital transformation in the life science organizations and what effect that's going to have within the organization's cultures. And he's going to stay on, and Robin's going to pop off as Tom Lau, the Chief Operating Officer for MedicaSafe, will come on and talk with Prem about how MedicaSafe's technology works and the importance of remote medication adherence and patient monitoring that has presented the challenge in remote care. After that, we're going to then go over to an interview with Dr. Renee Manwaran, the Associate Professor of Pediatrics at the Northwestern University of the Feinberg School of Medicine. And she's going to actually be talking to Dr. Stan Kishnowski, who will be here for the symposium at some point. He couldn't stay away, and he'll be interviewing her, and they'll be discussing opioid misuse in adolescents after surgery, and how tech could play a part in handling that misuse. So really continuing that trend of medication adherence. And after that, we're going to go to a panel with Don Jones, the chair of the Digital Medicine Society, and Sarah Vaezi, the Senior Vice President and Chief of Digital Growth Strategy with Providence, as well as April Smith-Hyrick, the Regional Health Administrator for the US Department of Health and Human Services. So really exciting panel there, where they're going to be talking about the delivery of care, and particularly specialized care in underserved populations, and how digital is having that impact on driving health equity at a government and private standpoint. So it'd be good to get those two viewpoints as to how digital is working. And last but not least, taking us home all the way to the end, we're going to have the recently crowned innovation champions at the recent Accenture Health Tech Innovation Challenge, Ellipsis Health, led by Susan Solinsky, the co-founder and chief growth officer of Ellipsis Health, interviewing Meg Columbia-Walsh, the global marketing leader of healthcare services for Amazon Web Services, talking about Meg's journey from founder to exited CEO, and also the importance of honoring women tech pioneers, which I think will be a really great discussion, since Susan also heads up the Women's Health Tech initiative and the Women's Health Tech Challenge, which we have some exciting news about for everybody today. And of course, at the end, I will wrap everything up with a reminder of upcoming HitLab events to get everybody hopefully dispersed for a very late lunch or an early tea time, depending on where you are in the world watching today. So we'd like to, of course, thank our generous sponsors who are sponsoring today's symposium, without whom we couldn't bring you such quality content. So a real thank you to the folks of Epiture, Medidata, Remember Stuff, LiveCare, Medosity, Curio, HealthX Solutions, and of course, Goodwin. So I think that wraps up the introductions, and I'd like to just take a quick minute before we have Paul Saunier, Eric Novick, and Sergey Askanov come on for the first segment to just let everybody know about the Women's Health Tech Challenge that's going to be taking place on December 17th. So HitLab's Women's Health Tech Challenge that we hold annually, where we're opening the call for applications to all women entrepreneurs and founders in the women's health tech and femtech space. So if you are a female founder or a female entrepreneur in the health tech or femtech space, please do visit hitlab.org/WHT to find out a little bit more, and also to apply or share if you know anybody else that has got an innovative femtech solution that we could have at the pitch challenge. There'll be more information on that in the chat box, so do please check out the chat box as to where to go for that, as well as keep up to date with HitLab on all the different social channels, Instagram, Twitter, LinkedIn, and Facebook, to keep up to date with events and other activities that HitLab is doing within the digital space.